Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us try to answer some OSCE in gynecology, and this is part 6. You can see other parts before, but today we have some new OSCE. Okay, let us start with the first. Identify from this picture palm-coin classification of abnormal uterine bleeding. As we all know, palm-coin classification including the commonest causes of abnormal uterine bleeding. So, B for what? B for polyp, A for adenomyosis, L for leiomyoma, M for malignancy or endometrial hyperplasia. And this is one of the structural causes of abnormal uterine bleeding. What about the non-structural causes? In the word coin, C for coagulation dysfunction, O for ovulatory dysfunction, this is the ovary, ovulatory dysfunction, E for endometrium causes, I for iatrogenic causes like IUD insertion, N non-identified causes. So this is the palm coin classification as you see in the picture. When I ask you write it, so you should tell me this abbreviation denoting what. Okay, as you see in the picture, this is a polyp, this is adenomyosis, this is a leiomyoma, this is a malignancy. Okay, here is the coagulation dysfunction, here is the ovulatory dysfunction, here is the endometrial causes, arteriovenous malformation or inflammatory, and so on. I for iatrogenic as an IUD here, N non-specific, and some or non-identified. Some put the scar, deficient scar after cesarean in non-identified causes, by the way. Okay? Okay. This is the first station. Let us go to the next. Look to this picture, please. Name the procedure. This is hysteroscopy. Identify A and B. A is intracavitary leiomyoma or fibroid. What is the type of A according to FIGO? Which type of fibroid? This one, the intracavitary one. This one with pedicle is called type 0 according to FIGO. So this is leiomyoma, and the answer, what is the type of A according to FIGO? This is type 0. I didn't say letter B denoting what? This is the uterine cavity, the endometrium. The normal endometrium or uterine cavity. So the pathology in A is leiomyoma, and the B the uterine cavity and the endometrium. Okay? With no other pathology. And the pathology here is type 0 leiomyoma. What is the common presentation and the ideal treatment for this case? The patient commonly complain of heavy menstrual bleeding, or the old name menorrhagia. Heavy menstrual bleeding or menorrhagia. Also, she may complain of colic, uterine pain. Okay. What is the ideal treatment for this condition so long as it is a single intracavitary type 0 leiomyoma, 4 centimeter or less. So hysteroscopic resection of this leiomyoma is the best line of treatment. Hysteroscopic resection of leiomyoma. Okay? Let us go to the next station. During gynecologic examination, the following in the picture was found. Identify A and the best line of treatment. During the speculum examination, you found the portion of the cervix and this lesion. So A denoting cervical polyp, mostly mucous polyp. This is a large polyp and this is a small polyp. So two polyps here, large and the small polyps. Okay. What is the best line of treatment is to do surgical polypectomy. If it is suggested to be mucous polyp with a stem pedicle, you can use ring forceps and twisting until avulsion of the polyp is done and send for histopathological evaluation. Okay? What is the presentation of such a condition? The patient may complain of spotting, vaginal discharge, irregular bleeding, or post-coital bleeding. Okay? Okay, look to this picture, please. Identify the difference between A and B. A and B. A, there is septate uterus here. B is a normal uterus and genital organ. So, the abnormality in A is septate uterus. How to diagnose A? How to diagnose septate uterus? By visualization directly via hysteroscopy or by hysterosalpingogram. Okay. What is the best treatment of uterine septum in A? Hysteroscopic metroplasty or hysteroscopic resection of uterine septum is the best line of treatment. However, if asymptomatic and no complications, you may do just follow up for the patient. But if the patient at risk of recurrent miscarriage or preterm labor, so hysteroscopic resection of the septum, what's called metroplasty, can be done via hysteroscopy easily. Okay? This is the best line of treatment if it is needed. Go to the next, please. During gynecologic examination, the following in the picture was found. As you see in this picture, identify A, B, and C. A is a portion of the cervix. B is the vaginal wall. C is ectropion or erosion. The old name called erosion is now not used anymore. Ectopy or ectropion replacing cervical erosion. Okay. What is the best treatment for C? Okay, you should know that cervical erosion or ectropion can occur physiologically during pregnancy, during adolescence, in a woman taking combined hormonal oral contraceptive or gestogen like medroxyprogesterone acetate. So hormonal effect of oral pills or injectable or hormonal effect of pregnancy or adolescent phase cervical ectopy or ectropion can happen. Okay? So if it is asymptomatic, it needs no treatment. But if the patient is symptomatic. If the cause is hormonal pills, try to stop this method of contraception and replace it by another one, non-hormonal. Okay? But you should do a differential diagnosis for cervical ectropion and exclude CIN and infection by using exclude CIN by doing pap smear during screening program, colposcopy. Okay. Also, you may need to exclude infection like chlamydia and gonorrhea by nucleic acid amplification test. Okay. The patient of cervical ectropion may complain of vaginal discharge, post-coital bleeding, interministerial spotting, back pain, dyspareunia. So this symptomatic woman is the ideal who needs the treatment. So what is the treatment? Cauterization by diathermy electrocauterization, or cryotherapy, or laser therapy for this ectropion to replace this columnar glandular tissue by squamous epithelium. So damage of this one to replace it with squamous epithelium. Also, we can use polydeoxyribonucleotide like Albucil vaginal suppository as a treatment of cervical ectropion. So I can use chemical medical treatment, silver nitrate, polydeoxyribonucleotide, vaginal suppository like Albucil. You can use electrocauterization with diathermy. You can use cryotherapy. You can use laser therapy using carbon dioxide. So laser therapy or electrocauterization or cryotherapy or medical treatment, all of these are lines of treatment of cervical ectropion if the patient is symptomatic and after you exclude the infection with chlamydia and gonorrhea and the CIN by cervical intraepithelial neoplasia by doing pap smear and colposcopy. This is the end of this OSCE. I hope it was helpful for you. This is my site on Amazon where you can find my books. I put it in a comment. This is my site on YouTube where you can find many other OSCE stations, also lectures about obstetrics and gynecology and the family planning. So you can find it. I'll write my site in a comment on this video. Thank you, everybody. Wishing you all the best.